Good afternoon, everyone. Thanks for joining us today. As usual, I'll begin with an update on a number of cases in our province. Since the last media release, we have 2 new positive cases in the province. These cases are within the Western Health region. Public health contact tracing is ongoing, and everyone who is identified as a close contact will be asked to quarantine. Total number of cases in our province is now 244. By region, we have 227 cases in Eastern Health, 8 in Central Health, 3 in Western Health, and 6 in Labrador-Grenville Health region. 53% of cases are female and 47% are male. By age, there are 20 people under the age of 20, 37 between 20 and 39, 33 between 40 and 49, 53 between 50 and 59, 54 between 60 and 69, and 47 who are 70 and above. 9 people are in hospital due to the virus, and of these patients, 3 are in intensive care. 133 people have now recovered, and in total we have tested 4,907 people. We are still in the very early stages of this pandemic, and in keeping the number of new cases to a minimum will help ensure that our healthcare system has the ability and capacity to readily respond when needed. Last week, we updated the screening criteria for testing to include 2 or more of the following symptoms that are new or worsening: fever or signs of a fever, such as chills, sweat, muscle aches, and lightheadedness, cough, headache, sore throat, and or runny nose. This is broader than the previous symptoms, which were aches and pains, fever, and symptoms of respiratory infections such as cough or difficulty breathing. Also this past week, we were testing staff and attendees at hospitals, long-term care facilities, personal care homes, home support workers, paramedicine, people who work at correctional facilities, and people who attend correctional facilities, emergency shelters, housing programs, transition houses, and daycares. These are tested based on symptoms, and there are no exposure criteria necessary. Although the few new cases of COVID-19 over the past number of days in our province is encouraging, it is certainly not an indication that we can relax our current efforts. In fact, if we want to obtain the intended outcome of reducing the spread of the virus in our communities, we must remain steadfast in our collective actions and continue to adhere to the public health measures that are in place. I think it would be fair to say that this past holiday weekend tested our resolve against COVID-19. It was reassuring to hear stories of how people adapted their regular Easter traditions by visiting family members online, sharing messages of thankfulness on social media, and dropping meals at doorsteps that would have typically been enjoyed together, all while maintaining safe physical distancing. It was also heartening to see the many rainbows and messages of hope displayed in people's windows in my neighbourhood. Quite clearly, this speaks to our resilience and support for one another. While this week would have been Easter break in Newfoundland and Labrador and a time for many families to take vacation or children to participate in sporting events or simply for each of us to enjoy some downtime, we know this has not been our typical spring. COVID-19 has interrupted our lives, our customs, and our interactions with others. And while this has brought about feelings of stress and uncertainty for us as adults, it may be even more anxiety-provoking for our children, who are well accustomed to a daily routine, extracurricular activities, and the freedom to spend time with their friends. It is now more important than ever to foster supportive relationships with our children to help alleviate any fear they may have related to COVID-19. Be attentive and speak with them about their concerns. Let them know there are many people working hard every day to keep them safe. And there will come a time again when they will be able to resume their lives, doing all of the things that they enjoy. As a recap, for those who may have just joined us, we have 2 new cases since yesterday's media release. The total number of cases in the province is now 244. There are 227 cases in Eastern Health, 8 in Central Health, 3 in Western Health, and 6 in Labrador-Grenville Health. We have seen evidence of how together we can curb the spread of COVID-19 in our province, but we need to keep this momentum going. Please continue to do your part. Stay home as much as possible. Only go out for essentials. Wash your hands often and well, and use proper cough and sneeze etiquette. And please remember to stay home if you're feeling unwell.